So for our in-service presentation, we had Huntington's disease. We decided to do a PowerPoint. It's Nan, Jenny, Nicole, and myself. So what is Huntington's? This is kind of our little umbrella term that we'll dissect as the presentation goes on. But as a whole, it's a progressive degenerative brain disorder, and it can result in jerky, random, uncontrollable movements, has two onsets, and co-occurs with specific disorders as symptoms. So the uncontrollable movements are known as chorea. It can also be plural, choreas. And it's so notably characterized by the choreas that Huntington's disease is often called Huntington's chorea. So for etiology, it's hereditary. It's an autosomal dominant disorder, meaning that you would get one gene from your mom, one gene from your dad, and only one of those genes has to be affected in order to show the disorder. And the gene that has to be affected, it's just one single gene, and it's called HTT. So the course is that it's degenerative brain disorder, meaning that it's worsening until passing. In fact, after the diagnosis in adult onset, typically the lifespan is 10 to 30 years after the diagnosis. And then juvenile is more severe, and they typically pass about 10 years after the diagnosis, which is really severe. The lesion is located in the basal ganglia, and the cells begin to die in the caudate nucleus. The caudate nucleus is really important for degenerative brain disease. In fact, it was shown a lot of research in Parkinson's disease.
So more etiologies for Huntington's disease. Causes of deterioration include intellectual ability, emotional control, as well as balance. Onset is usually in adulthood, and the symptoms usually develop between 40s to 50s, and it's the most common form of Huntington's disease. However, there is also juvenile Huntington's disease, which occurs in children and teenagers and is very rare. Key features of Huntington's. So hyperkinetic dysarthria is characterized by abnormal voice, resonance, speech sound production, prosody, and those all impact intelligibility. And the involuntary movements that are characteristic of hyperkinetic dysarthria significantly impact communication, deglutition or swallowing, and quality of life. Individuals with Huntington's disease also often have psychiatric disorders co-occurring, including bipolar disorder or clinical depression. And as Emily mentioned, chorea is a key feature, and dysphagia as well.
So there are several different cognitive deficits that will present itself with one who has Huntington's disease. And so according to the University of California, San Francisco, cognitive changes include memory loss, the inability to multitask, poor calculations, and one will also appear to be disorganized. So the most debilitating aspects of someone who has Huntington's disease will include cognitive and behavioral changes, which lead to an overall functional decline. Striatal and cortical atrophy are the most common findings, and they correlate with cognitive deficits in attention, working memory, and executive function. Dementia can coexist with HD, causing rapid cognitive decline.
So dysphagia is very common. It has a very high prevalence in Huntington's disease, and it is most notably characterized by difficulties in the oral phase and in the pharyngeal phase. So in the oral phase, they tend to eat too fast, so they just put large sips and bites into their mouths before they're even done swallowing the previous bolus, and this could cause choking or increase the risk of aspiration. They also have anterior bolus loss, they have impaired bolus formation, they have a delayed initiation of swallow and a difficult time initiating a swallow, and they tend to have a lot of oral residue. And in the pharyngeal phase, they have a very difficult time coordinating breathing and swallowing, and they have impaired airway protection. They have reduced epiglottic inversion and vocal fold closure, and they tend to have a lot of pharyngeal residue. Some suggested evaluation materials is the MOCA, And Paulson said that the MOCA offers great utility for the screening of cognitive impairment in HD, and we can also use the modified barium swallow study and the fiber optic endoscopic evaluation of swallow to objectively evaluate dysphagia in HD.